Slifka. I'm the chair of the subcommittee on improving police interactions with the disability community. Looking forward to today's discussion. But as always, before we get started, I will go around my screen and have everybody introduce themselves that is here this morning. And I will get started with Mr. Clark. Good morning, Mr. Clark.
Good morning, Mr. Chair. Andrew Clark with the IMRP, and we're supporting the task force.
All right, thank you. Good morning. And good morning, Dr. Peterson.
Good morning, Mr. Chair. Good morning, everyone. Megan Peterson with the IMRP. Thank you.
Thank you. And good morning, Mr. Ahimsa. It's nice to see you this morning.
Morning, I'm the staff interpreter for Aging and Disability Services. I'll be interpreting today. Thank you.
Thank you. And good morning, Mr. Chege.
Yes, good morning, everyone. My name is Alvin Chege, and I work the Department of Aging and Disability Services as the Human Services Advocate for individuals who are deaf, deafblind, and hard of hearing statewide. It's good to see everyone. Good morning.
Good morning. Thank you. And good morning, Ms. Goodwin.
Good morning, Maggie Goodwin, retired social worker, here representing National Association of Social Workers in Connecticut and the Social Welfare Action Alliance.
All right. Thank you for being here. And good morning, Ms. Duarte.
Good morning, I'm James Orr from the Connecticut Department of Mental Health and Addiction Services, Prevention and Health Promotion Division, and the Connecticut Suicide Advisory Board.
All right, thank you. And good morning, Mr. Foley.
Good morning, everybody. Brian Foley, Department of Emergency Services and Public Protection.
Thank you. And good morning, Ms. Tepper Bates. Nice to see you again.
Hi, Jonathan. Hi, Andrew. Glad to be here representing United Way of Connecticut 211, together with my colleague, Annie Scully.
Thank you. And good morning, Mr. Pelka.
Morning, Mr. Chairman. Mark Pelka from Office of Policy and Management, Criminal Justice Policy and Planning.
Thank you. And good morning, Mr. Anderson. Nice to see you again, my friend.
Good morning, Mr. Chairman. I'm Brian Anderson. I represent 2,000 municipal Connecticut police officers with AFSCME Council 4. I'm not part of the task force, but appreciate the opportunity to listen and learn. Thanks.
Thank you. Happy to have you here. And good morning, Bill. I don't want to mispronounce your last name, Bill, so but good morning and welcome.
Yeah, my name is Bill Dogel. I'm a retired social worker with the state. And I'm also representing the Connecticut chapter of NASW and the SWAA Connecticut chapter as well.
All right, terrific. Thank you for being here. Good morning, Mr. Marshall.
Good morning, Tim Marshall from the Department of Children and Families. I'm the Director of Community Mental Health Services. I also help to facilitate the Suicide Advisory Board with my colleague Andrew Duarte and Tom Steen. And then also I help to support the state's 988 initiative from DCF side. Thank you.
Terrific, thank you. And Ms. Duarte, I apologize that I mispronounced your last name earlier. Sorry about that. Good morning, Chief Drum. Nice to see you this morning.
Good morning, Mr. Chairman. Good morning, everybody. Jack from Town of Madison, Madison Police Department.
Thank you. And good morning, Ms. Scully.
Hey, good morning, everyone. Excited to be here with Lucy Tepper Bates, representing United Way of Connecticut.
Thank you. And good morning, Ms. Bagan.
Good morning, everyone. I'm Dana Began. I am a program manager with the Department of Mental Health and Addiction Services within the Evidence-Based Practices and Grants Division. Thank you for inviting me. Nice to see you all.
Thank you. Good morning, Mr. Russo.
Hi, good morning, everybody. I'm Vinny Russo from DCF. I'm the Legislative Program Director.
Thank you. And good morning, Ms. Mason. Nice to see you, my friend, this morning.
Good morning. It's great to see everyone's faces. Looking forward to the discussion.
And good morning, Ms. Knopf.
Good morning. I'm Gretchen Knopf. I am the Director of the Department of Services for Persons with Disabilities for the City of New Haven.
All right, thank you. And good morning, Ms. Northup.
Good morning. I am a second interpreter for this meeting. I'm Kat Northup, and I am working with Source Interpreting.
Thank you for being here. And good morning, Mr. Petrolito. You're on mute, Mr. Petrolito. Okay, if not, we will move on. Good morning, Ms. Lopes.
Morning, everyone. I'm Maureen Lopes. I'm here as a public member, very interested in what's moving forward from this committee. And I have lots of thoughts about how that may be helpful to my faith community.
Okay, thank you. And good morning, Ms. Ozix.
Good morning, Mr. Chair. Mackenzie Ozick with IMRP and CCSU.
Okay, and thank you. And finally, good morning, Ms. Romblad.
Good morning, everybody. I am a parent of a child with a disability. I serve on a number of committees, task force, and so I am learning a lot. Just I'm here as really public person.
Okay, thank you very much. All right, that's everybody this morning. So the next item on the agenda is review and approval of the minutes from the August 31st meeting. The minutes were provided in the meeting invite. If you've had a chance to review the minutes, if someone wants to make a motion or any amendments as appropriate.
I'll make that motion.
Okay, motion's been made by Chief Drum. Is there a second to approve the minutes?
I'll second.
Okay. Second by Ms. Knopf. Any discussion? Okay, all those in favor?
Aye.
Okay, any opposed? Okay, the motion carries. The next item on the agenda is section 4 is updates. And we'll start with updates on the social worker recommendation reports. And with that, I will turn the floor over to Dr. Peterson.
Thank you again, Mr. Chair. Good morning again, everyone. As far as an update on the social worker feasibility reports, to date, there have been 79 that have been submitted and subsequently reviewed. And I recommend and suggest that the subcommittee consider adding a visual breakdown of those reports. So, Mr. Clark, I don't know if you have that document at the ready, or I can share it on my end as well. But I can.
Yeah, I'm taking a look at it right now, and I think I can bring it up.
So just to introduce it, it is a visual and numeric breakdown of the police departments by locality size as to whether they said yes, no, or maybe to the feasibility of a social worker or social workers as part of their crisis response. So what I've done here is I've broken it down again by population. And so the first category, your smaller municipalities or towns, you have 8 that have been submitted to post. Of those, 62.5% said no for a variety of reasons, whether it's low crisis call volume, budgetary constraints, safety considerations for the responding social worker. A quarter of those said yes. As you go up, the trend does indicate that the larger the locality, the more feasible they are stating. Of course, there are exceptions, and that's why you have these percentages. So I recommend that this be included by way of background for the social worker feasibility recommendations. And just as a note, all 5 of the largest localities in our state have said yes, social workers are feasible as part of a crisis response. And so your mid-size, I mean, I can go through this, but your mid-size localities, you have, let's look at the 21 to 39,000 or 40,000 almost. You have 22 that were submitted in that category. Of those, 36% said no, 41% said yes, 23% said perhaps if certain safety considerations were alleviated and addressed, if budgetary constraints were addressed. So a lot of these maybes are contingent on those factors that have been cited in the recommendations document. So yeah, so that's just what I recommend, that it be included as a visual breakdown.
And Mr. Chair, if you'll allow me, just for the benefit of members who didn't participate or watch the last full task force meeting, which happened after our last subcommittee meeting, Ms. Peterson did present the recommendations that we forwarded along from the subcommittee in the form of a document that everybody has seen. And this, the task force has not voted on it as per our normal protocol. We present recommendations at one meeting and the next it's up for a vote. So the document wouldn't be up for a vote until the next meeting. There is some precedent in tweaking recommendations. We've done that in the public awareness subcommittee based on information that comes in, new information that comes in from the subcommittee. So this, I think, as Ms. Peterson is proposing, would just be added as context for the discussion on crisis response that we had in the recommendations, correct?
That is correct, Mr. Clark. This would simply be sort of background material that prepares the reader for understanding the recommendations, because they're grounded in the Connecticut specific data and information that we have analyzed. Yes.
And so, Mr. Clark, so just for clarity, how would you recommend we proceed from here with this data in mind? Just
it's nothing substantive in terms of it's more just background. So I would think that without objections, it could just be added.
Okay. So I will open the floor up to see if there is any objections or discussion on that data, and if not, we will move forward. Okay, seeing none, we will move forward with that, and I will move on to the next agenda item, which is the sequential intercept model recommendations. And again, I will return the floor over to Dr. Peterson.
Thank you again. Yes, as far as the update on the SIM framework, so in essence, this is a template that we are using to guide and ground the research as we look at various tools and mechanisms designed to improve police interactions with the disability community in our state. And so this is this document is grounded in that model. Again, SIM, alphabet soup, the sequential intercept model, which looks at different points in time that people have or may have contact with law enforcement. And so at the intercept 0, this is pre-law enforcement or pre-police contact. This is where you have your community services, community resources, your Connecticut United Way, your ARC, all of these community resources that can be mobilized for the disability community. And then at Intercept 1, we have the law enforcement contact. So at Intercept 0, you have 211, 988. At 1, you have 911. And so we're looking at primarily Intercept 0, that sort of preemptive prevention, sort of, again, that pre-police contact. And then at Intercept 1, we look at, okay, once the disability community has come into contact with law enforcement, what do we do? How can we improve that contact from the law enforcement side and the disability community side? It's a two-way reciprocal interaction. And for now, at this time, we have not gone through the subsequent intercepts. So we're just looking at, again, community level resources and then law enforcement resources, all in an effort with that eye on improving police interactions.
And Mr. Chair, again, by way of background, this document that I'm sharing the screen, I didn't include it in the invite for this current meeting because we did approve it at the last one, but I can, after I stop sharing, I'll send it to members through that invite so that they have it. But this is the document that was presented to the full task force at our meeting, our last meeting. And this is the one that under the social worker feasibility voluntary registry, this area here is where we would be adding the context of the social worker report that we just discussed. I mentioned that because further on down the agenda, items that we will be discussing will also be relevant to this document, and I can pull it up later. But just so folks know, again, this was presented and it will be voted on at the next task force meeting, which I believe is, I'll have to get the exact date for you, but it's in October on Tuesday.
Okay, terrific. I see that Ms. Romblatt has a question.
I just wanted to state from that last slide, I was a little confused as to why it was being, I just think that there needs to be a description on there to explain that some of these costs, there's more than just a social worker cost accrued for these departments, especially when servicing the disability community. So just for example, there could be a cost accrued for getting appropriate translators to a site. So do these organizations know that there's additional costs that can happen during this process? I just want to make sure that that was clear, or was that talked about?
So I think with respect, I mean, Dr. Peterson, I'll sort of lean on you here, but I think with the feasibility, I mean, I think costs were part of the thought process. Feasibility, when
but what were the breakdown of the costs? There's no breakdown of all the additional costs that can be accrued. I'm just looking to see and understand what are the exact costs that would be accrued for them. That the major 5 towns, with the most amount of people probably have bigger funding, but the smaller towns have less funding, obviously. But does everybody know the types of costs that are accrued?
So as a matter of fact, in those police department reports, in many of them, there are budgetary breakdowns that anticipate specific costs that would accumulate as a result of the hiring. And so they do build that in. So it is broken down. Many of the police departments have broken those costs down in anticipation of hiring or not. And that is why in some of those maybe categories, the yes and no's, you see that they actually state that budgetary considerations are a part of their response. And that's why they say maybe not at this time due to budgetary constraints, which are exactly that. They're budgetary limitations.
Thank you, Dr. Peterson. Ms. Goodwin, you have a question.
Yes, I don't know. As I said, I'm not part of the official group, but just hopefully we can work with Dr. Peterson. But there are many options in the way police departments can work with social workers. One of them is, of course, hiring them as part of the police department, but another is contracting with perhaps nonprofit agencies that would, include some of those other costs. And so I'm hoping that when we're talking to police departments that we look at that option, because in some ways it may be more helpful to have a social worker who is not directly in the chain of command with the police department and has some of those emergency services that nonprofit agencies build in, and safety issues as well are addressed by the nonprofits who are going into many of these communities without the police as well as with the police. So, hopefully, Dr. Peterson, we can talk some more about some of that offline.
If I may, I'm so glad you raised that, because in some instances you do see different models where instead of the PD directly hiring on the payroll, there is the option of contracting out. There's also another option of joining with another PD, which leads also to the CIT approach, which combines that social worker behavioral interventionist design. So yeah, there are a number of different models that we have seen come through in these reports. It's not just, oh, you have to, that is one option to hire directly and be placed on the payroll. But another option for those who do have budgetary constraints is to contract out. Absolutely. Yeah. And we see that from those reports.
In the document that was recommended, that's number 2 in the recommendations on social worker feasibility. So I did send the document out to everybody. All of the members of the task force have seen that, but the newer members or members of the public may not have. But we've discussed those options.
And that, if I may, that is why those social worker feasibility recommendations identify community-specific needs, because it may be the case that one community decides to hire directly, but another may decide to contract out. Still another may decide to join forces with another PD and locality in a regional approach. Sort of 3 different options. And those are reflected in the recommendations. No, thank you, Mr. Clark. Perfect.
Okay, Ms. Deborah Bates, you have a question.
Yes, hi. I just also wanted to flag an additional model. So in my capacity as a private citizen, I'm a member of the Police Commission in Stonington, Connecticut. And in Stonington, the police chief worked very creatively to actually use police funding, which is combined with funding in the Department of Social Services for the town. And so that's just an additional model that Megan, I don't think was referenced here, but is worth thinking about. And for smaller towns, that could even be a 50-50 split, for example. So I just wanted to mention that as something also worth exploring.
All right, thank you. All right, any questions or further discussion on this agenda item?
Mr. Chairman.
We will move to the next agenda item, the CBA Policing Task Force recommendations. This is our 3rd viewing of this.
Mr. Chair, I think Chief Drum may have had it.
Oh, I'm very sorry, Chief Drum.
Yeah, I just wanted to add to that, as Ms. Bates spoke to Stonington and others, most police departments in the state are probably going to do something with it, somehow a partnership with the Youth and Family Services or other social services in town. They're also going to probably be working with the school psychologists for those of that age group. And in addition to that, an example, the town of Branford just hired a full-time social worker. Our model is a little bit different here in the town of Madison. Are there going to be some folks on the fringe in the disability community that we're going to have to find additional funding for? Absolutely. That's going to be a challenge for the budget process, but we're still going to ask for it. Thank you.
Thank you, Chief. Sorry about that. Sorry that I missed you. Okay, anything else on that? Okay, we'll move on to the next agenda item, the CBA Policing Task Force recommendations. This is our third viewing. This will be up for a vote. I will, Mr. Clark, should I turn the floor over to you or?
Sure.
Thank you.
So this is, the third viewing of this subcommittee proposal. And it, by way of background, to reiterate, or for those that this is new information, the Connecticut Bar Association created a policing task force shortly after the incident with George Floyd, similar to the legislature reinvigorating the policing task force that we are a part of. In order to try to combine efforts, we've had some instances where the CBA task force has sent forth recommendations to various subcommittees, most normally the logistics subcommittee, but this one has come to the Improving Police Interactions with the Disability Community Subcommittee because of the very nature that it's talking about. As Dr. Peterson referenced, that Intercept 0 fits squarely with that proposed 988 call line. So we've had a few folks from the CBA subcommittee present to us on this. I am not sure, I don't believe any are on Skip or are on today, but they've given us some background as to why they proposed the three recommendations that are a part of the document that was shared with everyone. I can share my screen and show that as well. So in conversations with the chair and Dr. Peterson and reflecting on the conversations in the subcommittee, we did some more research and we noted that there is a group led by state agencies in Connecticut to implement the 988 line. So we thought we'd reach out and invite them to the meeting to give us some background on that, because we felt that more background was needed from members in order to make an informed decision. So I would just at this point invite them to speak to the 988 system, and then I imagine there will be some questions from members. So I don't know who wanted to take the lead on that, if it was Mr. Marshall or Andrea or Dana, but you're welcome to give us some background on the things you're working on with the suicide prevention hotline and how that intersects with 211 and these recommendations in particular.
Sure, I'm happy to start. And again, Andrea Duart from DEMIS and Tim and Dana, who've already introduced themselves, are also co-leading this initiative with the support of course, Mary Kate and Vin, who are also here. Thank you. But I'd be happy to give you a quick overview, and then folks can jump in as they see appropriate. So this project that we have been working on to develop the state's plan for implementation of 988 is driven by a grant that we received from Vibrant, which is the nonprofit that oversees the National Suicide Prevention Lifeline under the Substance Abuse Mental Health Services Administration contract. And following the federal law that was passed last October, almost a year ago now, to initiate the 3-digit line starting July 16th, 2022, each state is preparing a plan essentially to implement this. For really the focus is on calls, chats, and texts. And I'll also certainly recognize United Way of Connecticut and Lisa here, who's been our longstanding partner in providing services for the National Suicide Prevention Lifeline here in Connecticut. And right now we have call services, and we have for some time. And the state agencies, DCF and DEMAS, partner to support United Way and providing those services. And then in time, we will be adding the chat and text as well as part of the 988. So even though the real focus of 988 is on the telephonic and chat and text service, it certainly is a door to the rest of the crisis system. So that's where a lot of other folks are participating in this conversation. We have approximately a 40-member coalition driving the planning process. We've performed, 10 focus groups in each of the DEMAS service regions, as well as a statewide key stakeholder survey to ensure that the state plan that will be submitted, the final draft will be submitted in January for a phase 1 and phase 2 does include key stakeholder input from folks that are representing various populations. So I think that's a good overview. I don't know if folks want to jump in and if I left anything out, but just I don't want to overwhelm you all with too much information. But I'll stop there. And if I see Tim.
Yeah, thank you, Andrea. I would just add one thing for folks. So there's a little bit of misunderstanding about the 988 system and the belief that it is only for the lifeline calls, that is, and callers who are suicidal. That is not the case. The genesis began there, but the 988 system for all states going live on July 16th, this coming July, was to take as many, if not all, mental health calls out of the 911 system and try to get them into the hands of the mental health professional community. So it's, as Andrea said, it really is attempting to take the same kind of coordination system that occurs under 911 with law enforcement, ambulances, paramedics, fire, et cetera, and coordinate that same kind of activity specific and exclusive to the mental health system. And like sometimes you need EMTs, sometimes you need fire, sometimes you need law enforcement, sometimes you need them all. It's a similar kind of system where the need of the person with the mental health challenge, there may be an avenue of 4, 5, or 6 different crisis systems, levels of care that could be diverted into. And so it's really trying to bring the expertise of the mental health community to bear on these situations. And this legislation, like the one you all are proposing, is along with many federal and other state initiatives whereby there's movements to try to support law enforcement in handling and responding to these situations that are not really law enforcement, but are really mental health, and to try to get more of their capacity directed to the community safety mandate and less towards the mental health. So I'll just add that and pause there.
That's great information, Mr. Marshall. Appreciate that, because I'm sure there was some confusion about that.
I think the other thing I would just add, and then I would imagine that, Vin and Mary Kate, you may have other comments, but if there are questions, is that that both agencies, because of our work in suicide prevention, I mean, Tim and I have been leading the Connecticut State Suicide Advisory Board that directs the state plan implementation for the past 10 years or so. And a lot of this work is part of our federal initiatives as well, has been the support of this line. So in looking at the Connecticut Bar recommendation, there was already a commitment, a longstanding commitment. What's been interesting in other states to see and how they've implemented this approach is, I guess there hasn't been a designated state agency per se that's committed to suicide prevention and the crisis system and such. So I think we were ahead of the game in a lot of ways, fortunately, in Connecticut, because we did have, committed state agencies. We didn't need to designate anybody. We already had longstanding relationships with the providers and supporting them financially, which we've had to, certainly consider expansion given what's coming up our way. And, and there have been proposals from the national level for each state on, what we can expect for volume and things like that. But I think that, the commitment is certainly there. We have contractual obligations with United, between DEMIS and DCF, United Way already in place related to this in terms of services as well as data reports and such. So I think, at least in terms of infrastructure, we're in a good place. But I would certainly invite any folks to, to add to that.
I'm sorry, Jonathan, I can't figure out how to raise my hand.
Oh, that's okay. So go ahead, Ms. Mason, if you're looking at comments.
I'm so sorry. I was searching for how to do it.
That's okay.
Okay, so we did review the recommendations as put forth, and I do want to register a concern, and I think this is probably shared by my sister state agencies as well, although I would not want to put words in their mouth. But I am concerned that there's a piece that recommends legislation to impose a federally authorized excise tax on mobile services or IP-enabled voice services. And I'm sure people are very aware of how controversial increased taxes can be, and can, in fact, sometimes kill initiatives when we are looking at increasing taxes. So I just think I would ask the committee to consider not including that piece on the in the recommendations. I feel that DEMIS and DCF are committed to making sure that the funds are available, and committed to making sure 988 moves forward. And if there was such time that it became financially impossible for the agencies to support 988, we would work with the budget office to make sure there was funding available. My concern is that taxes are very inflammatory for the most part, and we would not want 988 to get caught up in that kind of rhetoric. Does that make sense to people?
This is John. That definitely makes sense, and we appreciate that input, and we'll certainly consider that in our discussion today. Moving forward here. So I just want to make sure I've got several hands up, and there was also a comment in the chat. So Ms. Tepper Bates, you've been waiting patiently, so I'll start with you.
Thanks, Jonathan. I really wanted just to acknowledge both Tim and Andrea and their leadership for many, many years of the efforts in the state of Connecticut that really have put us well ahead of many other states. So thanks to them and to their departments for the partnership that we have. And just also wanted to make sure it's clear to everyone that 988, it's terrific. It'll be an additional channel, but we do now already have an infrastructure through which we are taking the National Suicide Prevention calls on the 800 number, which will stay live. So calls will continue to come through that channel. Crisis calls also come via the DEMIS supported action line. There are additional avenues as well. 211 option 1 is our crisis line. But the good news is, and it's important that we're clear about this, all of those calls come to one crisis team. So I just wanted to make sure everyone knows that it allows us to make that one team an important resource answering multiple lines so that we can really use it to the greatest extent possible. So I wanted to just flag that. And also, and I believe a few months back when we were able to do a presentation here, we shared this, but it's important, I think, as a bright light with regard to what's possible. In just the last year in 2020, the crisis team at 211 took 122,000 crisis calls. Some of those result in the dispatch of either the DEMIS adult mobile crisis team or the DCF supported crisis team for youth. But only 1% of calls required escalation to 911. And so I just want to put that out there as I believe a piece of information that really attests to how powerful this can be as a resource and in partnership with the very important resources of 911 and our local police departments. So thank you, Jonathan.
Thank you. And I'll go through all the other questions that are in front of us, and then I have one as well. Ms. Goodwin, you had your hand up. On you next.
Yes, I guess I would just add my kudos and congratulations to what Connecticut has done on the suicide and mobile crisis, and Demas's and DSS's leadership. And I have every confidence that we will build out a good 988 system. I just feel though I have to step in and voice the concern of the nonprofit community, the social workers and mental health providers, that what is the problem is that we need resources so that once the call is taken, that there's someone to provide follow-up and services. And this is the area that I'm most concerned about, and I think social workers and folks in the disability community are aware of, because there is a lack of places to refer folks that are calling in for suicide, but then who will be calling in for mental health crises. So just wanted to highlight that and hope we can highlight that going forward, because that's where the rubber meets the road.
Thank you, Ms. Goodwin. Appreciate that. Mr. Vogel, I know you had you asked a question in the chat. If you want to ask that as well as whatever question you have.
Yeah, actually, I did put my hand up after I put the thing in the chat. Mm-hmm. I noticed that in Tim Marshall's breakdown, there was no discussion regarding substance abuse and domestic violence. And one of the things that both Maggie and myself have in our exploration on this issue is that those could be areas too that not only just disabled people, but people in general really could benefit by social work or mental health interventionists versus utilization of policing. So I just wanted to ask the larger subcommittee group about that.
Mr. Marshall, did you want to?
Oh, I'm sorry. I thought he referenced the group. Yes, both of those would be appropriate calls to 988, and again, to the expertise of the system. Just to add to that, the data that was shared, I just would add that that volume allows for a great deal of competency development of the responding clinicians. And so on the child serving side, for example, of that 120,000, 20,000 of those were specifically related to children. And one of the things that we know on the child serving side is that children are not little adults, and that responding to kids is a different level of expertise than to adults. And so we feel strongly about when kids are involved that specifically trained individuals are able to respond. And of those, 20,000 calls annually, about 15 or 16,000 of those are episodes of the care, and about 20 to 25% of those are self-harm. My reason of saying that again is it really does raise the level of expertise for those who are responding and also disseminating out. And regarding the comment about follow-up care, so on the child serving system, our clinicians are able to maintain contact with the family for up to 45 days while linkages to the longer term better care is offered. And we don't see a huge wait list or additional wait lists that are occurring. Now, again, we don't know what the increased volume will be when we go public with 988. But so far, and I think we have a good plan for expansion of resources, and we're aware of some of the gaps where we do need to pay attention and to expand and enhance services. So I think those things would be addressed in our plan also. It's one of the pieces that's a requirement in our state plan. Thank you.
Thank you, Mr. Marshall. Mr. Pelkey, you have a question?
Oh, yes, sir. Thank you. Just to anyone who would be able to help, I was just curious with once 988 goes live next year, is there clarity that will be provided about whether to call 211 or 988? I'm just thinking about the overlap. It seems that each calls will work with callers in crisis and work through their need. I imagine it won't be duplicative layers. I'm just trying to think through in my mind what would be advised to the public wishing to call one line or the other.
Yeah, any of us can answer that. I'll do my piece, and then Andrea and Lisa could jump in if they'd want, or anybody else. But so it's not unlike what Lisa described already. So there are multiple lines in right now, and it is the competency and the expertise of the call specialists, the crisis specialists, to be able to funnel them out to the right moment. And so what we anticipate happening is just a higher volume of that. But really the issue is being certain what level of care, what is the need, and being connected and distributed to the right service at the right time. So, and there is ongoing marketing, social marketing, advertisement of our mobile crisis hotlines, if you will. The adult system does their piece, and 988 is coming with both a massive federal marketing. There is also going to be, each state in the country also has to add their own. So the marketing for all the numbers would continue, as well as new additional marketing will occur for the 988, and clarification on those points will continue to happen. But ultimately, they all funnel to the same point. So you can come in through many different access points. Andrea or Lisa, if you want to add.
Sure.
No, thanks. Oh, I'm sorry. Go ahead, Andrea.
Just very quickly. So we have 8 core areas we're responsible for in the plan, and the number 8 is about marketing specifically. So one thing that you should be aware of is we're very through the key stakeholder surveys and the focus groups, it definitely came out that this was an anxiety people are thinking about, when do we call which number? So you're totally on board with that. Just to say, the other piece that we've been doing in addition to marketing the mobile crisis services across the lifespan is the suicide prevention resources, certainly through the One Word campaign that we have for the state. And one thing that we've been working, Tim and I, along with our colleagues at Department of Public Health, co-lead a CDC grant for suicide prevention for the state that was granted last year through 2025. And they are very focused on expanding the campaign that way, which will integrate 988 moving forward. So part of the plan for 988 regarding that core 8 area is about actually collaborating. DPH is part of that planning committee, and we're part of the grant. So it makes sense to coordinate our marketing plan and the implementation of the materials, which will be based on folks who are using them. So whether it's individuals referring to this system or people who will need the resources, we definitely plan as part of that planning process. And before we can implement, we haven't been given approval to release any kind of campaign materials until after July. At the national level, they're really reinforcing this. They don't want us to promote until the resource is ready, right? So even though you may, for example, if any of you have tried on your cell phone to call 988, you will actually, it's automatically linked to the prior 800 number that still exists, and that'll never go away. The 800 line will never go away. The FCC actually demanded at the federal level that it would stay. So they're automatically linked. But you won't see any outward campaign materials coming out with 988 in Connecticut until after July 1st, essentially, once the line goes live, because they want to make sure everything is functioning properly. So just to be aware of that. In the meantime, we are happy to do presentations and to talk to especially informant groups that can help us create resources for them to use, whether it be police or schools or campuses, et cetera. So.
Thank you so much for coming to today's subcommittee. I've learned so much, and it's an incredible effort, coordinated across multiple state agencies with the nonprofits, with the larger provider base. So thank you for your hard work, and thank you for the update.
And Jonathan, if I could just add in, can I share a visual? Some people are visual learners, and if I can share my screen just quickly, is that possible?
That would be, I believe Mr. Clark is in control of that, so.
I just did.
That's great. And, you know, so just very quickly, for those of you who might respond better to a visual, this is the way that we think about it. There are multiple lines that come to the same crisis team. And so that's good news, Mark, to your question, because whether you call 988 or whether a person in crisis has seen that older 800 number for the National Suicide Prevention Line, or they call 211 and push option 1 for crisis, they will come to that same crisis team. And that's great news, because at any one moment in time, if there's an advertisement that has 988, that might surge. It will come to that same team. But if we're getting calls on those older lines, they're also going to come in to that team that we train at a very high level and in coordination with DEMIS and with DCF. So just wanted to flag that. It does take, the national experience shows it takes about a decade for a number to really be worked into public consciousness. So those of us old enough here to remember learning about 911 when 911 was new, it takes a long time, and it will take years, and it will take a lot of effort. So that's the good news about having those older lines still available, because those might already be known to folks. And so it would be a mistake to close down that access as we build the awareness of 988. So just wanted to also make that note.
Thank you. Mr. Clark, you have a question?
Yes. So I guess I'm trying to learn more about this from the original presentation and try to articulate some of the questions that were raised by maybe even some of the members that aren't here right now. I guess I want to go back to that resource issue, because for me, I go to my work on the Appropriations Committee, and you either are making something more efficient or you need more revenue. And I'm not sure I see the efficiencies on the 988 versus the 211. So to me, it seems like you do need to add some resources to it. And when you add resources, then you'd be taking away from others, and those resources may be the very things like the social workers are bringing up, which then I'm not sure why you wouldn't want to have that excise tax. If the state is saying that this is important, it's hard for me to see a direct line in this not being additive in making a system more efficient. So I don't know if that's articulating, and it's not to really, it's probably just that I'm daft and I'm not understanding it. And you guys have done a heck of a lot more work than me on this. And we've only just seen it from 3 meetings here and with all the focus groups and everything, but maybe just articulating something that might come up during the legislative process, if it's even going through that. But I just wondering if that could be explained. Because you're asking us to take away the excise tax recommendation, and I just don't see how that shouldn't be an option if we're actually adding services and saying we're not taking away something from somewhere else.
Ms. Mason, I know you got your hand up. If you want to respond, just and anybody, when a question is asked, if you want to just go ahead and respond, it's fine.
Thank you so much. And I do think the speaker does raise concerns that people will be expressing. But I think one of the things that we can can say is state agency budgets are complex. There are multiple factors that may be able to assist us. One of the things that we're looking at is capitalizing on Medicaid dollars, where if we can transfer some services over to Medicaid, then we receive a federal match on those, which is an increased income stream to the department, so, or to the state. So there is actually ways to kind of capitalize and bring money in without raising a tax. Additionally, DEMIS has historically been able to bring in incredible discretionary grants that help fund projects like this. And we also have a significant block grant allocation from the feds. And that block grant allocation can be deployed to support resources like this as other services move off and start to be funded by Medicaid. So while it does this, the simple answer is to raise a tax to do this. But as I mentioned before, taxes tend to be quite controversial, and issues can blow up because a tax is being associated with them. This way, we can look at all of the funding streams that are coming into the state and try and determine if we can fund this initiative with those resources or with the additional resources we imagine. So I hear what you're saying, but I think the one thing that you can rest assured is that DEMIS and DCF are very, very committed to 988 implementation. And if it began to look like it would be implementation or continuation of it would be jeopardized, then we would need to have conversations with our friends at the budget office to discuss taxes. But at this point, I really think it's premature. Right now, we are saying, and we know the money is available for implementation. So we really need to do the implementation, look at the real costs of implementation, look at the dollars that we have to cover those real costs, and then explore if we need to look into an excise tax. I just think at this point, it's premature. We have the monies right now, and based on our plans related to budget and Medicaid reimbursement and the federal match for that, we think we will continue to have the monies. So I hope that helps explain in a very short snippet conversations that have been going on for probably, I don't know, Andrew, 9 months related to funding. So if that's helpful, please let me know.
Definitely. And Bill made mention about the diversion aspect of things. If you're diverting more to the front end of the system, then the more expensive back end of the system may not be as needed. And I think it's just helpful to articulate that to people so that they have a sense of, how it's all adding up. But yeah, definitely. So I'm just wondering if it's not necessarily within the recommendation, and I don't know what members want to do, but maybe not taking out the tax, but just saying if needed or something like just having that option available. But you obviously will have it available anyway, regardless of whether or not we say this within a recommendation. But just trying to make everything add up.
I think the option, as we said, is available in the future. And I think sometimes when we put a recommendation like that in the beginning, like I said, that becomes the focus rather than the really incredible work and the need for 988. So we don't want to distract from 988 implementation by having a secondary conversation that may derail the first one if we're talking about increasing taxes. And while people will argue it's only a small amount of money, I would say, as you all know, there are people in our communities where a small amount of money makes a drastic impact. And some of those people are the ones that need 988 the most. So we want to make sure that we're not placing any burden on any citizen, but giving them a resource.
Can I just add to what you said, Mary Kay, if you don't mind? So very quickly, what I'll just add is that fortunately we have MSW students, and they've done a lot of research and supported the development of the plan around this kind of area in terms of funding. And one thing that we have found, and I totally agree with Mary Kate, that timing is really important, and having the data about actual implementation will help guide what we need to do in the future. So that's all part of the plan. What we've seen, for example, like in the state of California, is that they, will introduce legislation. It ended up dying in committee because the focus, like Mary Kate just said, was on the tax, when there were other components of the legislation that they actually really needed to go through because of infrastructure issues or policy and procedure needs between 988 and 911, things like that. So what we're really focused on now, since the funding, at least for the moment, is good, is, what kind of things may we need in place to ensure that the service is going to go smoothly, right? So that's really what the focus is for the moment.
Thank you. Ms. Goodwin, you have a question?
So just another comment. Again, funding, I think, is so important for not so much. I have great confidence in you guys that you're going to be able to get this system up and running, but the funding and maintaining it. But if you really want to save lives and prevent suicide, and if we want to really tackle so that there's not a constant use of the crisis services, there is needed funding for, and I speak for today, the disability community, the BIPOC community, for nonprofits and community organizations, as we want to help, we want to serve, we want to work with people, but people have to put money and resources into not just crisis management, but basically mental health services. So I love people that are thinking about funding. So I think it was Tim, it's definitely going to do this well. The service end is going to need more money.
Okay, thank you. I have a question that could be just a comment as well, and I believe I brought this up when 988 was first, when the concept of 988 was first introduced to us. In looking at this from an accessibility standpoint, we recently had a text to 911 option, and I don't see that, at least in these early stages of this 988 concept. And in thinking of, individuals in the disability community who are nonverbal, who are in the deaf and hard of hearing community, who would not otherwise use the phone to communicate verbally or otherwise, I think from an accessibility standpoint, including a text option to this is vital and critical to that community. And if discussions around that are not being had at this point, they need to start. And so if anybody wants to comment on that, they
Sure.
do. But
core area one is that. So United Way at this point does not use the text and chat option. In fact, most National Suicide Prevention Lifeline providers do not offer text and chat. There are only a few that do. And so part of the implementation of 988 is for the Vibrant, as I explained earlier, is the lead to engage these centers in adopting the text and chat options. So that is definitely the plan. And Lisa, I don't know if you have anything you want to add about that.
Thank you, Andrea. Yeah, and Jonathan, absolutely. You're exactly right. And, again, we're really grateful for the close partnership with DEMIS and with Vibrant as we move toward that. We have actually wanted, Jonathan, for a long time to do more with text. But these are often issues of bandwidth and resources. So one of the really exciting things that is possible right now is, and to the resource discussion, I do want to just say that DEMIS has really scrambled to make additional resources available. We are in the process right now of doubling the size of our crisis team, which is much needed. But also an important way that we're building towards that bigger and better capacity to handle these important calls, and being able to build out, together with the assistance of Vibrant, our texting capacity for this purpose is really exciting and is something we've wanted to do for a long time. So that's what I would say to you, and it's in progress. So if it's helpful, we'd be glad to have another conversation with you in a few months' time. But please know that work is underway. We've got our track shoes on, and we're going as fast as we can to get this up and running because we do know that it's important. And I want to pay respect to Mr. Cheggy because this is the population that you represent, Alvin, and we appreciate that. And we want to stand this up as fast as we can. So please know that that's our commitment, and Andrea is our partner in that.
One thing I will also just quickly add is that it's my understanding that 988 through video relay services for the deaf and hard of hearing have actually been available for quite some time. So if someone who is deaf or hard of hearing does use video relay services.
Yes, that is true.
Yeah.
Yeah, and thank you, Andre, for mentioning that. And just, for everyone on this call, we very, very often are partnering with Video Relay. We did that, including during the COVID vaccine scheduling, but also for crisis calls and for sort of regular, if you will, calls to 211 looking for childcare assistance, food assistance, what have you. We work almost daily with Relay. So that's absolutely right. Andre, thanks for calling it out.
Yes, you do.
Thank you for your work on this as well.
It's been great. It's been great to have that partnership with you guys.
Okay, are there any other questions or comments on this? Okay, if not, Mr. Clark, do you recommend that we proceed voting on this item by item based on the discussion today? What I'll turn the floor back over to you for driving us through this.
So yeah, if you look back, well, why don't I share the screen so the recommendation is up there. And just because this is new, a new process for our subcommittee, what, for instance, the logistics subcommittee has essentially adopted an entire recommendation and sent it forward to the task force. We don't necessarily need to do that. And one of the things that may be good is to incorporate anything that we do say into the recommendations document that was discussed earlier, so that these aren't separate and maybe somewhat confusing to folks. So it could simply be that we adopt the recommendations and don't necessarily have the introduction and all or we can incorporate some of that. But I think this is a little bit of, threading a needle. It's apparent that there's a huge undertaking in 988 and that there's going to be a lot of information coming forth from the various folks that talked today to the legislature and otherwise about this. And I'm not sure we need to necessarily provide as much background because I think it sounds to me like that would be provided. So it may simply be that the subcommittee chooses to endorse the recommendations as they stand. There's the 1, 2, and 3. There has been some discussions about the funding aspect of it, so we may want to do that separately, but maybe my recommendation is that we do adopt them separately. So that you'd have the number 1 would be to implement the federally mandated 988 crisis hotline system.
Okay, so if we can take, if someone would like to make a motion to adopt number 1, to implement the federally mandated 988 crisis hotline system. And my screen is being shared, so I can't see everyone.
I'll make that motion, Mr. Chairman, as stated.
Okay, thank you, Chief. Is there a second? Mr. Clark, am I allowed to make the second?
You are?
All right, I will second the motion. Okay,
Jonathan, it's Gretchen. I was trying to do that for you.
oh, okay. Okay, thank you, Gretchen. So, okay. So all those in favor? Okay, any opposed? Okay, so that motion passes. Next would be a recommendation or a motion to recommend an enhancement and expansion of the behavioral health crisis response and suicide prevention services statewide.
Again, I'll make that motion as stated.
Thank you, Chief. Is there a second?
Second.
Thank you. Thank you, Ms. Knopf. Okay, any discussion? Okay, all those in favor?
Aye.
Any opposed? All right, that motion passes. And finally, number 3, funding the system through SAMHSA and DEMIS grants, reimbursements from private and public insurers, and funds raised by imposing a federally authorized excise tax on commercial mobile services or IP-enabled voice services.
Again, I'll make that motion as stated.
Thank you, Chief. Is there a second? Thank you, Gretchen. Okay, all those in favor?
Jonathan, can we just discuss for a moment, because I thought that Andrew had said that perhaps we could suggest a modification with regard to the tax issue that would say if needed. Should we discuss that now, or do we vote?
Yes, I'm sorry. We should have discussion before taking. So yes, go by all means. If we want to have discussion.
I would propose, I guess, as a modification of the amendment, that language would be our counter proposal, given what we've heard from our partners here, that we would just add that if necessary with regard to the tax.
If necessary, sure. Okay.
So that would read then, fund the system through the SAMHSA and DEMIS grants, reimbursements from private and public insurers, and funds raised by imposing, if necessary, a federally authorized excise tax.
Right. If necessary is specific to the excise tax. Correct. Okay. Thank you. Okay. So there's a friendly amendment on the in front of us.
Does that need to be seconded, Jonathan?
It would need to be voted on and vote. We would need to vote and second that motion with the friendly amendment. Mr. Nogel asked a question. Mr. Nogel asked a question in the chat. With the impasse on federal police reform legislation in DC, will it have a negative impact on the implementation of the 988 system? I'm not sure who might be best to answer that.
So I'll take a stab at it, but I would defer to Andrea. We are full steam ahead for implementation of 988. I am unaware of any issues that would cause, but Andrea, please weigh in.
We're moving forward. I don't know that we necessarily need the additional push, but I would invite other folks from DEMIS or DCF to speak up as well if there's any concern.
From a programmatic standpoint and just trying to kind of think about it, it doesn't seem likely. I mean, there's so much momentum and efforts behind the national movement at this point. I don't see it, but again, that's more of an opinion than it is. I'm not sure anybody of us here can predict the future, but it's just not likely. It's where we're at.
Thank you.
Also, I would just say, the federal legislation makes it pretty clear that the states have to do this. It's about how we go about doing it is up to us, but it's pretty clear that participation is not really an option.
Okay, so with the friendly amendment that was proposed, would someone like to make a motion to approve recommendation number 3 with the friendly amendment? Okay, the motion's been made by Ms. Knopf. Is there a second? I'll make the second. Okay, all those in favor? Okay, any opposed? Okay, the motion carries, the motion passes. Thank you. Mr. Pelka, you have a question.
I just wanted to explain that I reluctantly voted no on that just because of the hypothetical in there as if needed. It just felt to me that the 988 system has been, budgeted at the state and federal resources. I understand there are uncertainty around increased need. I couldn't vote in favor of that final amendment, but I look forward to continued discussions in the full task force, and thank you.
Okay, thank you, Mr. Pelka. Appreciate that. Okay, we will move on to the next agenda item, section 16 recommendation. This is our first viewing of this, and with that, I'll turn it back over to you, Mr. Clark, if you'd like, or even if you don't like, I'm turning it back over to you.
All right, so I just shared my screen. This is a memo that was sent by NASW, the Connecticut chapter, by Stephen Wenzik-Karp, the executive director. I know there are some folks here today that are representing this group, and it was essentially sent to the full task force, but the task force chair felt that the Disability Subcommittee would be the best place for it to start. So Section 16 of Public Act 20-1 is what also governs the task force. It calls for a behavioral health assessment of all police officers no less than every 5 years. As the law reads, the assessment is to be performed by a board-certified psychiatrist or psychologist with experience diagnosing and treating PTSD. And their recommendation is that we include in our recommendation that Section 16 be expanded to include licensed clinical social workers. And then it gives a little bit of a background. So I think it'd probably be okay with you, Mr. Chair, to open the floor to those members.
Yes, of course.
So Bill or sorry,
Maggie or
Maggie, yeah, I believe, if you wanted to discuss this at all.
Mm-hmm.
Yeah. Bill, you want to do it or you want me to?
Well, obviously, haven't been a social worker for 42 years and retired now, but currently still very involved with the social work community. Full agreement with what Steve proposed there. I believe that there are national statistics that state that 70% of all mental health interactions are done by licensed clinical social workers. And that doesn't preclude, obviously, the emphasis of psychologists and MFTs and LPCs. They obviously are valuable people, but social work really does do yeoman's work in regards to mental health and substance abuse interventions throughout the system. So I think putting us under the umbrella and giving us the opportunity to be able to be reimbursed for our services and utilize our experience and overall perspective would very much be welcomed, speaking for my colleagues. I don't know if there's anything, Maggie, you may want to add there.
No, I just think that it would give police departments a lot more options. And I think they will, in fact, if we just look at the statistics that Steve said, there are many more of us than there are psychiatrists and psychologists, and the psychiatrists are very overworked and unavailable many times. And psychologists are doing more of a an assessment using testing, and this would be more of a trauma-based assessment, clinical as well. So we're hoping that you would consider that and that we would be at it.
Thank you.
Does anyone have any questions or reservations that we could address?
Sure. Let's Ms. Temper Bates has her hand up, so we'll start with her and go from there.
Thank you, Jonathan. I just wanted to call out again, referring to the work that I have been doing as a private citizen in our police commission. It is really challenging to find someone that meets the relatively narrow set of qualifications of the original legislation. Not because we are not trying. It's hard and it's expensive. And those are things that are pointed out in this letter. So I would say from that angle of really practical experience with our police department, trying to both manage the cost and actually the logistics of someone who has the qualifications and can be available on the time frame required, I think this is a really helpful recommendation, and I would hope that we would be able to support it.
Thank you. Ms. Knopf, you have your hand up. You have your
Just
hand up.
quick question. Are you, I like the recommendation, but are you requiring the LCSW to also be experienced in diagnosing and treating post-traumatic stress disorder as part of the recommendation? That doesn't seem totally clear to me.
Well, I would say that you could do that. I would say that at least from the training and licensing requirements, that really is pretty much part of the licensing criteria. I think you could put it in. I don't know how you would, determine that other than, the licensing procedure. But I would assure you that I think most of the LCSWs, while they may have different clinical approaches, are certainly well trained and to deal with trauma and the kind of incidences that police officers would be dealing with.
So in keeping with that, it says that the law does require right now that the board certified psychiatrist or psychologist have experience diagnosing and treating post-traumatic stress disorder. So how?
I think that would be fine, but to add LCSWs, because that's a clinical license, okay, like the psychiatry and psychologists.
Okay, thank you.
And leave those criteria in.
Yeah, and just to piggyback on what Maggie was saying, obviously the bulk of us have been well-trained in DBT and other trauma-informed approaches. And also a lot of us have been trained in how to deal with violent people without necessarily using hands-on approach and using de-escalation tactics that would definitely aid in dealing with a situation and not allowing it to escalate.
Thank you.
Thank you.
Are there any other questions or comments on that?
I guess the obvious question would be, why weren't you included in the first place? Was that just an oversight? I know during this time, this was the only bill that passed in the General Assembly, and it was also in the midst of COVID, and the interactions were not normal for the legislative process, so it may just have been an oversight, but I didn't know if you had any information on if there was. And if we do make this recommendation, it would have to go through the legislative process in order for it to pass anyway. So these issues may come up, but I just didn't know if anybody knew why.
Well, it's my understanding that Steve Karp, the executive director, did try diligently to get the LCSW included, but for whatever reasons, the legislature at the time opted not to include us. but we fervently believe we should be included. There's a tendency sometimes to view social workers as the people who provide rides for people or give out clothing or food stamp vouchers. But the breadth in which our particular discipline is very wide range, and it's very eclectic, and it uses a very holistic approach to how to deal with situations. It's not always medically model driven. And I know for people in the psychiatric community and the substance abuse community, they want people to have a wide range of knowledge about how to deal with certain very tentative situations in the field. So.
Right. And I would just say, I mean, part of it, I think, is that people don't really know about the profession and all of the things that we do. And I do think that we will have folks in the legislature. We do have a social work caucus. We have 6 social workers who are legislators and would certainly work in making sure that this change was made. And I think we're getting better at educating the community and the legislature about the broad range of social workers.
Okay, thank you. Are there any other questions or comments on this? Okay, seeing none, if anyone would like to make a motion to move this language forward to the full task force.
So moved.
Okay, technically, Lisa, you're not on the subcommittee.
Oh, well, then I better not make the motion.
I'll make the motion as stated, Mr. Chairman.
Thank you, Chief. Is there a second? Thank you, Gretchen. Okay. All right, any further discussion? All right, all those in favor?
Aye.
Okay. Okay, the motion passes. Thank you. All right, that is all of the items that we need to address today. We will move on to our other business section. If anyone has any other topics or issues to raise this afternoon.
And Mr. Chair, this was the section where I know there were members that had expressed some concern about whether or not the recommendations that we offered before were all inclusive. So we gave folks an opportunity if they had any other business in recognition that we may not have very many more meetings, maybe 1, maybe 2 at most, because the rest of the work will most likely be done at the full task force in anticipation of the December 31st deadline of our final report. So
correct. Okay, if there are no other issues to be raised or topics to be raised today, our next meeting will be October 26th at 11 a.m. And depending on the issues that we are addressing at that time, that very well could be the final meeting of this subcommittee. And, all right, with that, I will entertain a motion to adjourn. No one wants to adjourn?
I'll make it.
We were waiting for the chief.
That's right. It's been the chief drum show today with the motions. Okay, the motion's been made and seconded. All those in favor?